Welcome, and thank you for spending some of your time with us. My name is Tina Rosenquist, and this is Knowledge for Wellness. And this show is to better inform you, because when you know more, you are empowered to make better decisions for yourself and your loved ones for a better quality of life. And knowledge is power. And today's topic is on chronic pain and fatigue. And bringing us this great information is Dr. Force. He presently owns the Pain and Brain Healing Center, located in Blaine, Minnesota. Now, he is a recognized expert in a field of chronic pain and fatigue health, lecturing internationally to doctors on a variety of subjects, including chronic pain, fatigue, hypothyroidism, autism, and ADHD. He also discusses depression, neurodegenerative disorders such as Alzheimer's. Now, his clinical experts include many years of teaching and successfully treating a wide variety of complaints by utilizing alternative therapies. Welcome, Dr. Force.
Hi, Dean. Thank you for inviting me here.
I'm so delighted you could join us on Knowledge for Wellness and also introduce this new chronic pain and healing. Now, what was it that actually got you into this?
Well, partway through my career, my daughter developed fibromyalgia, and it was quite devastating. She was around 16. It came to the point where she had to actually crawl up the stairs to get to her bedroom. The pain was so severe. Brought her many places. No one really offered much for her. She had developed fibromyalgia at a very young age. So because of this, I went back to school to become a neurologist, a board-certified neurologist. Then began teaching other doctors the techniques that I utilized to help her out of her fibromyalgia.
Okay.
And been doing that since.
Wow. What kind of health care do you actually do then?
Well, I'm a chiropractor,
Yes.
and then went on to become a board-certified chiropractic neurologist. But the type of care that I focus on is something called functional medicine.
Yes. So what is functional medicine?
Well, today we have really three models of healthcare. We have the disease care model, where you come in, you explain your symptoms, and the physician then gives you an ICD-9 code, diagnoses your disorder, and then matches that with a drug. Okay.
Yes.
And that really isn't getting at the underlying issues, because there's underlying metabolic dysfunction that's taking place within the individual. On the other hand, we have a lot of alternative therapies, massage therapy, aromatherapy, massage therapy. All these things are good, but they're not really getting at the underlying metabolic dysfunction, which is really ravaging our population today.
Yes.
And there's a lot of reasons for this.
Well, they're not actually getting to the core of the actual problem. They're manifesting it by, using the drugs, which
Right.
is, beneficial for the time, but we actually want to heal that person.
Right. Drugs have their role at times, but they're
Yes.
really more a very high-powered treatment for a very diseased state. But let's take metabolic syndrome
Okay.
or prediabetes.
Yes.
Actually, today, a recent study came out rather recent that showed 40% of adults in the United States are pre-diabetic. That means they'll be developing diabetes within 10 to 15 years.
Yes.
Now, you can identify that by running proper laboratory tests, blood tests, maybe looking at hemoglobin A1C.
Okay.
It actually will tell you if you're on the trend towards diabetes. Now, medically, they use this to follow diabetics. But the American Diabetic Association says it's a very predictive biomarker, if used properly, to see if the trend is such that you may be developing diabetes. Other ones that I utilize in practice is using triglycerides to HDL. People get their blood fats measured, and they talk about the good cholesterol and bad cholesterol. Well, HDL to triglycerides, which is another blood fat, that ratio is also very predictive of future diabetes.
Sure.
So by using these lab tests as biomarkers, we can predict that the individual is trending in a direction that is not very healthy. And then by intervening with diet and nutrition, nutritional supplements, we can start to turn this around.
Okay. Well, you actually have your degree as a chiropractor in DC, and you also went to Northwestern College, and then you also went back to school to learn.
I'm a graduate Northwestern College of Chiropractic.
Yes.
Then went on to a 3-year program in neurology that then I went on to sit for my boards and became a board certified chiropractic neurologist. I've also, through Northwestern Health Science University, is certified in applied herbal sciences, and I'm also nationally certified in acupuncture, which I utilize a great deal in my clinic.
Sure.
But most of my career has been in studying functional medicine,
Okay.
and that has been an ongoing process for the last 25 years. And I mean, I go to functional medicine conferences every year. I'll be taking off next week, in a couple of weeks, to a functional neurometabolic conference. So
Okay.
the education's ongoing constantly. I'm either teaching or attending. So,
So what kind of individuals do you see then? If you are actually a chiropractor, do you see a specific type of?
well, the vast majority of people coming to see me are people who've had chronic pain and fatigue.
Okay.
They're on multiple medications. They're usually on an antidepressant or two. They're on antihypertensives. They've come to a point in their life where they're saying, I just can't keep doing this, adding one drug on top of another.
Yes.
And there are no medical studies today that actually test an individual. Drugs are tested for, but they're not ever tested for in combination.
Oh, okay.
You know, in other words, we don't ever run tests on individuals like what happens when we add a hypertensive to an antidepressant to another drug, and then what happens to that individual when we add all these drugs together. There are no studies that really follow this. So people are really guinea pigs in today's society, adding all these drugs and not really understanding the side effects that can come about to that.
Right.
So many individuals are looking to get off this merry-go-round.
Yeah, the diet of drugs, as my mom calls it, because actually when she's doing all of hers, there were over 6 pills. And, you know, it just seemed to be.
And they've never been tested in combination.
Right.
So we have no idea how they're interacting with one another. But so individuals that come to me say, look, I've had enough. I want to heal.
Sure.
So I utilize laboratory medicine. We use blood tests, look at biomarkers for measurements within the body. Say like a test is HSCRP. CRP can be a measurement for chronic inflammation.
Okay.
That is a really underlying problem in many degenerative disorders today. It's even gotten in popular press. Systemic inflammation, low-grade inflammation. You sprain your ankle, it becomes red and swollen. That's acute inflammation, or you get a sliver. That's a healing process.
Right.
But this low-grade inflammation, this sort of smoldering fire inside, it's what blocks insulin receptors and makes you develop metabolic syndrome. It starts to create pain. One of the first signs of systemic inflammation is this achy tenderness and pain, because the pain receptors are being stimulated by this chronic inflammation.
Sure.
Well, this chronic inflammation is stimulated by the poor diets that we eat, SAD for short, Standard American Diet, SAD.
Yes.
Then there's also the chemicals in our environment. They're ubiquitous. There was a study where they actually took the umbilical cord blood of newborns, tested it for 418 industrial chemicals.
Yes.
Out of that, they found, on average, 287 chemicals. 216 of them are toxic to the brain and nervous system. That's one of the reasons we're seeing now 1 out of 90 births autistic.
Oh.
I mean, so we are committing a tremendous experiment today. Devitalized foods, an environment that is filled with chemicals, polypharmacy with multiple drugs, and people are finding their health going down, and they don't know where to turn.
Yes. We've been hearing more and more about thyroid problems, and how is this related to chronic pain?
It really ties into what we're talking about as far as chemicals, because a lot of these chemicals are endocrine disruptors.
Okay.
We now hear about hermaphrodite alligators in the swamps. I mean, our world is awash in estrogen-like compounds from plastics. Well, you drink out of a plastic water bottle, you're getting different chemicals, and estranils there. And there's also many of these endocrine disruptors that actually disrupt thyroid function. And thyroid is becoming a very hot topic, and part of this is because of this whole issue with chemicals.
Okay.
And it does tie into chronic fatigue, because when the thyroid isn't working right, you're going to feel fatigued, down. And every cell in your body has receptors for thyroxine. So we see symptoms from anything from brain fog to fatigue to pain to constipation, hair loss, chill, cold hands, cold feet. All these things tie into thyroid issues.
Okay.
And so that's something we focus on at the clinic. We really want to delve into what's going on as far as thyroid dysfunction.
So do we actually want a doctor to check our thyroid then when we go in, or is that something that you're specific in?
Well, that's huge. I mean, and sometimes most patients will come to me and they've had a TSH run, or maybe a TSH reflex to T4.
Okay.
TSH is a thyroid stimulating hormone.
Yes.
The pituitary stimulates the thyroid. And it's a good marker for about 17% of those who have hypothyroidism. So it's missing quite a few.
Yes.
It turns out that when the thyroid is getting, shall we say, lazy, the pituitary will increase the output of this TSH to try to kick it in the pants to get going.
Yes. Give it a jump start.
Yes. And so when a doctor sees that the TSH levels go up, they will give Synthroid or levothyroxine. That's the artificial or synthetic thyroxine.
Right. Which a lot of people are on right now because they're
Huge
gaining
amount.
weight and there's other issues that go along with that after they've been taking it as well. Yes.
But a lot of people are missed because one of the issues is that T4, or thyroxine is what they take, has to be converted to the more active form called T3.
Okay.
And that's done in the liver and peripheral tissues.
Sure.
So unless a doctor measures the T3 level, they don't know if you're actively converting from T4 to T3.
Oh.
So there's an issue there. So that's called underconversion hypothyroidism. And many doctors don't run these tests because that's not part of the standards of medicine. Insurance companies will like to pay for maybe a TSH and maybe a T4.
Okay.
But that T4 a lot of times is total T4, so it's bound by protein. And it's only the free form, the unbound portion, that is biologically active. And the T3, the free T3, is the most biologically active. So unless you're testing for these, you're not really fully diagnosing or getting into the depths of what's going on as far as thyroid function.
Okay.
That's missed a lot of times. Another thing that's missed is something called Hashimoto's disease. 70% of those who have hypothyroidism in the United States have Hashimoto's.
Oh. Could you explain what that is?
Hashimoto's is not so much of a thyroid issue, it's an autoimmune disorder. And you've maybe heard of autoimmune like lupus and rheumatoid, all these are growing too because of the things we talked about as far as chemicals and poor diet. Well, Hashimoto's is where the immune system is attacking the thyroid.
Oh.
So the thyroid starts to decrease in its function. It can't put out the thyroxine. And with that, medically, they usually just follow that, keep adding in the Synthroid as the levels of natural production of thyroid goes down.
Okay.
But a more intelligent approach is to try to discover why is the immune system so angry? Why is it attacking the thyroid? And what else is it attacking and making dysfunctional in the individual? So we find a lot of our individuals who are complaining of fibromyalgia, chronic fatigue, chronic pain, have Hashimoto's.
Oh.
And that is a very underdiagnosed issue because you have to run something called thyroid antibodies, the antithyroglobulin and anti-TPO, these antibodies, which measure the amount of activity against the thyroid.
Okay.
So unless you're measuring this, the free T3 and the thyroid antibodies, you're missing a big picture of the thyroid issue.
Okay. Now, there's also 6 different pathways of hypothyroidism and slow metabolism. So I think our viewers would really like to know more about that as well.
Well, the first one is the one where you're not stimulating the thyroid. So that's the one that they catch. About 17% fall into that category. The second one, if I can list them all off, is this underconversion. You're not converting, once your thyroid produces the thyroxine, you're not actively converting it to enough free T3.
Okay.
Medically, they'll follow free T3 in hyperthyroid cases. But I find a lot of my patients, even though they're on Synthroid, their free T3 levels are low. And that's why they're taking the medication. Their lab tests are normal as far as TSH, but they're still thinning a hair, gaining weight, feeling tired. So they're not getting enough active T3 conversion.
Okay.
Okay. And then there's more. There's a thyroid resistance issue where your cells start to become resistant to your own thyroid. So no matter how much you take synthetically, you're just not getting into the cells. Sort of like insulin resistance. We've talked about that in metabolic syndrome.
Sure. And we also talked about a low thyroid. And is there something that you can actually conquer naturally with this?
All right. So we want to look at the entire health individual.
Sure.
There are ways, a great portion of them have Hashimoto, so we have to quiet down that inflammatory autoimmune response. And then if we quiet that down, many times the thyroid will start to respond. We use other forms, desiccated thyroid support, The conversion issue, there are certain nutrients that can be done to help the liver convert T4 to T3. So
Okay.
it really depends on the whole picture of the individual, but there are natural ways to go after normalizing thyroid function.
Sure. And let's just say that I'm going to be coming and seeing you. So
Okay.
if you could just walk me through my first visit with you.
All right, well, an individual comes in, and we have a history form that's online. And I
Okay.
really want an in-depth history because I want to know all about your health.
Sure.
What kind of diet you eat, just all the things that take place within your life that help give me a picture of that. And that's a 17-page fill in the blank. It's fairly simple, but it's fill in the blank, but it's 17 pages. So,
Sure.
and then we sit down together and go over that. And
Okay.
people bring in past lab work, and then I do an examination. A neurological, orthopedic, nutritional exam. This whole visit will take maybe about an hour.
Okay.
So it's going to be in depth.
Yeah.
Based on my findings from your history and the examination, I'm then going to order laboratory tests.
Okay.
And we look at very extensive blood tests to look at biomarkers for what's taking place in your body now. Are you developing metabolic syndrome? Are you pre-diabetic? Do you have low-grade inflammation? That's why you're so achy and fatigued. Is HSCRP elevation up, or is fibrinogen elevated? We look at these biomarkers.
Sure.
And then many times I add something called a urinary organic acid profile. They do these at the University of Minnesota. These are tests that actually look, it's a first morning urine test,
Okay.
and these metabolites that come off in the urine can tell me about cellular energy production, how well your cells are functioning.
Sure.
Okay. We use digestive stool analysis. That's huge because a big issue today is something called dysbiosis. You actually have more bacteria in your GI tract than you have cells in your body. So the old physiology joke is, are you here for it or is it here for you? Because without that bacteria in your gut, you may be seeing those commercials on yogurt commercials on TV. People
Yeah.
are getting aware of probiotics. But we do a digestive stool analysis to see, are you actually have good, healthy bacterial growth, or do you have some things growing that shouldn't be there?
Right.
Candida, certain bacteria in the gut. And that can be a real source for stimulating the immune system and creating inflammation or autoimmune type response. So by using these battery of functional laboratory testing, I get a picture of the patient with the exam and history. And then we'd set you on a course of dietary nutritional intervention.
Okay.
How you can turn your life around with this sort of a support.
Yes, we're hearing more and more about the candida also, and I also feel that we're knowing more about chronic fatigue syndrome, and it seems to be increasing in prevalence throughout the United States.
Again, the reason is it comes down to our sad diet, standard American diet, fast foods,
Yes.
a great documentary called Food Inc. I don't know if you've seen that. I recommend that to everybody. It looks into how our food is produced
Yes.
and how devitalized it's become. Chemicals in our environment. All this is impacting our physiology.
Exactly.
And we're becoming more inflamed, we're becoming more insulin resistant, thyroid, hormonal dysfunction, all this is taking place. And that's why we're having trouble with trying to look for one drug or a couple drugs to fix this, because you can't fix this underlying metabolic dysfunction
Right.
by taking drugs that really impact upon the physiology and sometimes create more side effects. So yeah, we're seeing more and more, just like we're seeing more and more autism. As I
Yes.
mentioned, 1 in 90 children today now have autism or born autistic.
Yes.
And that again is not because of greater diagnostic skills or anything, it's a quadrupling of the number in just over a little over a decade.
Yes, very much.
So we're seeing this growth in neurological disorders in children, or asthma, that's gone huge, or allergies. We're seeing this whole neuroimmune dysfunction taking place in our children. We're seeing more and more adults developing depression, more and more adults developing chronic pain and fatigue. We're seeing more and more degenerative disorders like Alzheimer's. Every
Yes.
72 seconds, some old guy like me is getting diagnosed with Alzheimer's. Almost every minute. There's something going on here.
Yes.
And if we don't figure it out soon, we're going to see a trajectory of our population's health going down, down, and down.
Yes, we're seeing a lot more of diabetics.
Yes.
And it would be, here, take this pill.
Right.
And this is going to cure everything. Wait, let's take a step back. Let's look at the diet.
Right, exactly.
And then of course, if you think that you can stay on that pill the rest of your life and that's all you need instead of changing your diet or even the possibility of exercising, which makes total sense. So you look at that person and you look at their history, what they've gone through, and something as simple as maybe changing some of their food.
Right.
And the nutrition as
There was
well.
a government study that found just a lifestyle change that caused just a few pounds of weight loss was twice as effective as taking a drug as metformin in overcoming prediabetes. So you don't have to totally transform your life. If you
Right.
just start to eat better, lose a few pounds, there's actually physiological changes that will benefit you tremendously. But you're right, we're seeing a tremendous growth in this diabetes.
Yes.
I think 1 in 3 children born from the year 2000 on now will be diabetic by the time they're middle age.
Yes.
That's 1 in 3. 40% of adults today now are pre-diabetic. We're seeing this tremendous growth of this insulin resistance, metabolic syndrome. And what we usually wait for medically is that when the blood sugars get up over 100, 120, they start metformin or glucophage. And many physicians feel very frustrated that they can't make dietary changes. So in these quick visits, it's kind of hard to really get patients into a whole new lifestyle.
Yes.
It's much easier to say, here's the script, go get metformin, and then after you're on that for a few years, we'll get you on insulin, and after, and that all has its side effects. They're
Yes.
not going to fix the underlying problem.
Right.
And it takes someone who's going to work with you over time to help you steer a new course. And that's a time-consuming work, and that's the type of work we do at our clinic.
Right. We also want to inform people that they're responsible for their own health. And if they need to make some changes, now is a good time, because I would much rather be on a cruise ship when I'm older than actually in a nursing home.
That's exactly right. What we're seeing is that, Dean Ornish said, we're not sure if we're living longer or if it just feels that way. I mean, we're seeing people maybe living to an older age, but it's not a very healthy, vital age.
Yes.
What we'd all, I think, like is that rectangularization of our life where we live out to about 90 and then drop off quietly at night instead of slowly sinking in the sunset from 55 on.
Right.
And that's what's happening, being held together by scotch tape and drugs. And we need to take a different view of what our health is and what it means to have healthy aging. And that's another thing we work with at the clinic.
Yeah. Healthy aging is very important, because I know that after I've worked so hard all these years and I'm ready to retire, I want to be able to enjoy that time.
Yes.
And still be able to walk and function, and watching my mother and father continue to go downhill with the actual prescription drugs. I'd really like to entail them to have a quality of life at the end of their life. And starting now, because tomorrow is the rest of your life.
Exactly.
And that's so great that when you're working with someone and you spend that hour with them and you let them know, well, we don't blame you for your course of action of what you've already done, because they actually took the time to find out more about themselves. But let me help you, and you can help them get off that actual drug.
Right, that's our approach, to bring about true wellness.
Yes. So, Dr. Forrest, I also noticed that you've written a book, because we have so much information that we've covered.
Yes, the book is called Why We Hurt.
Okay.
It really was an outgrowth of that whole story about my daughter developing fibromyalgia,
Okay.
going back to school. I was lecturing at I can't remember exactly where, and a publisher come up and asked me if I'd like to write a book.
Sure.
And it's in its 3rd printing.
Oh, nice.
And it got a starred review from Publishers Weekly. It was actually said it should be required reading for all healthcare providers. But it's very accessible to the public. And it discusses all things we touched on today, as far as insulin resistance, metabolic syndrome, chronic pain and fatigue because of chronic inflammation, a dysbiosis. That was kind of a difficult subject we talked about, but that's all covered in here.
Okay.
Or chemicals, how the chemicals affect our health, and how detoxification can be a major role in coming to better health.
Yes.
And this book is 400 pages.
Yes.
So it's what we try to cover in a rather 15, 20 minutes a time. It's rather difficult. So if individuals really want to take a look at what I'm talking about, it's well laid out in this book, Why We Hurt.
Okay, and it explains it quite well, I'm sure.
Yes.
So we have a few minutes left, and I would really like for you to, throw something out to my viewers for watching you today, which would be great.
Well, what we do at the clinic for individuals who are curious about this, how they can enter into functional medicine, is that if they call the clinic, they can schedule themselves for a free consultation. Fill out that history form that's online, bring that in with any previous lab work, and we'll sit down together for 15 minutes. I'll look at what you're presenting as far as your symptoms and your history, and I'll let you know what I think can be done to help overcome your health issues. And this is at no charge if you call the clinic after viewing this program.
Wow. Well, thank you so much, Dr. Forrest.
Thank you, Tina.
Really appreciate your time and the insight on all this information.
Well, thank you.
Yes. If you have any questions, would like to contact Dr. Forrest, please contact them at www.painandbrainhealingcenter.com. Again, that's www.painandbrainhealingcenter.com. And please tune in to my other shows of Knowledge for Wellness being televised throughout the Twin City area. Or view my website at www.knowledgeforwellness.com for more detailed information in your specific area. And you can also connect with me on Facebook, LinkedIn, Twitter, and YouTube. And the mission of Knowledge for Wellness is to inform viewers on health issues, to expose, educate, and make viewers aware, to enhance themselves and their loved ones for a better quality of life. And I sure hope we have provided you with more knowledge to benefit you and your loved ones. Remember, health is wealth. So until next time, be well and goodbye. Thanks again, Dr. Forrest.
Thank you.
Over time you've healed so much in me, and I am living proof that although my darkest hour had come, your light could still shine through. And at times it's just enough to cast the shadow on the wall. Though I am grateful that you shine your light on me at all. Who am I that you would love me so gently? Who am I that you would recognize my name? Lord, who am I that you would speak to me so softly? Conversation with a love most high. Who am I? Well, amazing grace, how sweet the sound that saved a wretch like me. I once was lost, but now I'm found, was blind, but now I see. And the more I sing that sweet old song, the more I understand that I do not comprehend this love that's coming from your hand. Who am I that you would love me so gently?